there, I'm Dr. Joan Abatio, and today we're still talking about mental health. Let's have more unashamed conversation on mental health. Mental health is one of the leading causes of disability worldwide, and it's not given as much attention as it deserves. So today we're talking about another neurodevelopmental disorder called attention deficit hyperactive disorder. Like all other neurodevelopmental disorders, onset is during the developmental age. Well, with attention deficit hyperactive disorder, or ADHD, there is a persistent pattern of inattention with or without hyperactivity and impulsivity, and this interferes with normal life functioning. Then there are usually several symptoms present before the age of 12 years. So there are two key features: inattention, then hyperactivity and impulsivity. So one may have predominant features of inattention or predominant features of hyperactivity and impulsivity, or they may have combined features. When we talk about some of these features, you may realize probably have one or two of these, but for one to qualify to have ADHD, they must have several of these symptoms. So inattention features basically entail, things around wandering off task, lacking persistence, difficulty sustaining focus, and being disorganized. And you realize that someone has these features not because they're defiant or because they don't understand what they're being told, but because they can't help it. They're not well. So examples of inattention features: you'll see one often fails to give close attention to details or makes very careless mistakes. One has difficulty sustaining attention in tasks or play activities. For example, they can't focus in lectures, conversations, or lengthy readings. So one doesn't seem to follow instructions and fails to finish work. So they quickly lose focus on things and they're easily sidetracked. Then one often has difficulty organizing tasks and activities, and they're usually seen as not orderly or poor time managers. One often avoids tasks that require sustained mental effort, loses things that are necessary for performing tasks like phones all the time, wallets, eyeglasses, keys, things like that. And one is easily distracted by extraneous stimuli. Then when we talk of hyperactivity and impulsivity, well, hyperactivity basically entails things like running about, excessive fidgeting, tapping, talkativeness, and in adults and adolescents, it's usually seen as excessive restlessness. So then impulsivity, we all know impulsiveness. For example, one can easily dash into the streets without looking. One always makes decisions without looking at the long-term consequences. Yeah, so examples of hyperactivity and impulsivity features: one often fidgets, one is often tapping or squirming in a seat. One often leaves a seat in situations where remaining seated is the appropriate thing to do. One is often running about or climbing in very inappropriate situations. And in adults, it's often seen as restlessness. One is unable to play or engage in activities quietly. One is often on the go and is uncomfortable being still, for extended times. One talks excessively, blurts out answers before a question is even completed, completes people's sentences, can't wait for one's turn in a conversation. One always has difficulty waiting for their turn in line, interrupts others, is always using things without permission. So if you probably have several of these features, or know someone who has several of these features, or a relative, don't think someone bewitched them or something is wrong with them. They're sick and they need help, and they can be helped. They really can be helped. Let us find out if the person has ADHD, or if they have another medical condition that could present with somewhat similar features. Yeah, so well, one thing to note is it's often difficult to distinguish between ADHD and normal behavior before the age of 4 years, because before the age of 4 years, children are usually inattentive and restless, hyperactive, impulsive. But after the age of 4 years, if these key features persist, a red flag. Come, let's find out if something is wrong or if nothing is wrong. In most people, ADHD symptoms of hyperactivity, become less obvious in adolescence and adulthood, but the difficulties with restlessness, inattention, poor planning, and impulsivity often persist. So I want us to look at the risk factors of ADHD. When I say risk factors, I don't mean the causes of ADHD. I mean, factors that can increase the chance of someone having ADHD. So risk factors can be temperamental. For example, ADHD is usually associated with decreased behavior inhibition or constraint. Uh, Risk factors can be environmental. For example, very low birth weight. And I need to tell mothers out there, please, during pregnancy, always make sure you are taken proper care of. Your baby's health is our priority. Mental health of your child is our priority. We want your child to have, normal birth weight. Another risk factor that is environmental is smoking in pregnancy. Mothers out there, please do not smoke when you're pregnant. Do not take alcohol when you're pregnant. These things cross the placental barrier and can affect the unborn babies. You do not want to have an unhealthy baby mentally. Please do not smoke or take alcohol when you're pregnant. Another risk factor is child abuse and neglect, maybe neurotoxin exposure like lead, childhood infections. I'll say this again: when your child is sick, when your child is convulsing, that's how we call it in the local language here. Please take the child to the hospital. If let us find out what's wrong with this child. Let us treat this child. I will say this again: prevention is better than cure. Let's treat this child before it's a stage where we can't do much. ADHD can also be inherited. It's genetic. Well, it's not really easy living with ADHD. Most of the times people think you're a brat. They can give you all sorts of names. They think you're spoiled. For parents whose children have ADHD, it's not easy. There are lots of social stressors. People think you should have helped your child, you didn't raise them better, you're a bad parent, yet you did the best you could, and that's just how life turned out. I'm here to help you. Please seek medical advice. Do not, really beat up your child. Do not lock them up. You can be helped. And thank you so much for listening. We'll talk about another mental illness next time. Thanks a lot. Bye.